Grand Chief, our viewers might not be surprised that so many people are saying that they've experienced or witnessed racism in the healthcare system here in Manitoba. What in this survey stood out to you?
I think the incidence of people saying that they've experienced racism, also the incidence in which people say they've saw racism, and also the very high number of people who believe that there is racism within the health system reflects, I think, some real lived experience that we need to consider when shaping the future of healthcare in this province.
Something that stood out for me, somebody is quoted as saying, it's assumed when I go to seek medical attention that I'm a drug user. So I always start my appointments with, I don't want opiates or painkillers, or I'm not seeking painkillers. This works to a certain extent. But I don't know, what if some point I do have pain and I'm seeking care? I read something like that, that's not something that non-Indigenous looking people have to deal with. And it's widespread here in Manitoba. Is it concerning to you that more than half of the people in this survey said that they would avoid seeking medical care because of the racism that they face in the healthcare system?
It's a failure of our health, providers to make it so that, people feel like they want to have their health situation checked by a professional. They shouldn't feel like, if they go to a health provider that, they're going to in some way be harmed. And whether that's real or perceived, it really doesn't matter, because that's the current state of affairs, and we need to change that.
You've taken these findings. Have you taken them to the feds or to the province, and what's been discussed if that's been the case?
I think the province and the federal government are quite aware of the findings. It's a public report. It's add to a growing base of knowledge. Several reports prior have gone out with respect to health delivery, including the FINISM report, which looked at different regions throughout the province. It's adding to a growing, base of knowledge that strengthens, I think, the argument that there needs to be changes in the healthcare system. And, in other regions throughout the country, First Nations are in control of their healthcare system. And in fact, when First Nations are in control, I think we're starting to see better outcomes, because we're very focused on the patient experience. I think people have confidence in that their people, their leaders, and their own health system will look after them. And I think that is the way forward.
Shifting gears a little bit, you guys have another survey out right now asking about racism in policing. Are you seeing anything from that survey yet, or what do you expect to see?
I think the findings there are very preliminary for me to comment, specifically around, what the feedback is getting. But I can tell you that I wouldn't be surprised if much of the findings are very similar. And it's a growing part of what many people are quite aware of, and that is that the colonial system and the values embedded within the system are not favorable for First Nations people. Yeah. And that is why, we continue to see the kind of health outcomes and the kind of incarceration rates that we're seeing.
Well, thanks for taking the time to join us today to talk about this survey, and we look forward to the results of the one on policing.
Thank you.